Hi guys, this is Nurse Princess Monachimso. I'm here to educate you on health concerns on how to live a good and healthy life. Please do well to follow this page and share this to your loved ones, your friends and well-wishers so they would have an insight and knowledge on what we are educating on. On today's topic, I'm going to be talking on hypertension. Most of us already know what hypertension is. However, I'm going to use the most simplest terms I can as possible as we are all learning. Hypertension is an elevation in the blood pressure. Now, there are different things that can cause this hypertension, but there are major causes of hypertension and there are predisposing factors. Let's put them as primary and secondary. Now, the primary factor, which is genetically means when you inherited this sickness, okay? Now, if your father, mother, or any of your relative has suffered from hypertension, you are prone to suffering from hypertension. You are prone to suffering hypertension, rather. One thing I always tell people, it's when you think you have a problem, always accept there is a problem and then seek for a solution. Now, if you know you are predisposed to hypertension via genetics, that is, your family has suffered hypertension, it is only advisable that you keep checking yourself regularly. Now, another cause of hypertension is age. Age, however, doesn't have a discrimination. From 65 years, someone can just acquire hypertension from nowhere, even if the person is not genetically inclined to hypertension. However, 20 years old can also suffer hypertension. Yes, I said that. They also suffer hypertension, and we need to create more awareness on that. Another factor I'm going to be talking about is weight, obesity. Obesity can cause hypertension. Excessive intake of salt can cause hypertension. Lack of exercise can cause hypertension. There are so many things that can cause hypertension, including excessive alcohol and smoking. It all causes hypertension. Hypertension is called silent killer for a reason, because hardly does it have any signs and symptoms. Mostly it's headache. People usually complain of headache and they'll go and take paracetamol, which is being abused, and that topic is for another day. So when you know that you are prone to hypertension, a healthy lifestyle is important. Make sure you maintain a healthy lifestyle. Now, are you hypertensive? How can you manage this sickness? Because we all know that hypertension is a terminal sickness. So managing it is one of the most important way to living longer. There are different ways you can manage hypertension. First and foremost, maintaining a healthy lifestyle. Your dieting, your medication, your weight, they are very important when it comes to managing hypertension. Personally, I would say managing hypertension, the first step should be your dieting. Avoid excessive salt, and it doesn't just mean salt. Anything that contains a lot of sodium, avoid it. Now, your medication. There is something about medication, we all make mistakes in how we take our medication. If your doctor says take medication twice a day, please figure out a way to take it the same time every day. If you're taking it by 7 in the morning and 7 in the night, let it be 7 in the morning and 7 in the night. Not whenever you remember it. However, if you forget, just take it as soon as possible and continue with a regular timing. Timing in our medication, the time we take our medication also affects how it's going to work in our body. So yes, medication is one of the most important management in treating hypertension, or managing hypertension rather. Exercise and keeping fit is another important form of management, okay? Haven't mentioned this exercising as part of the management, dieting, your medication, healthy lifestyle, avoiding smoking and drinking. They are very important that you adhere to them. There are so many other ways you can manage your manage hypertension, but these are the 4 major ones, and whatever other ways are falling into these categories. Okay, now I'm going to talk on complications of hypertension. What is complication? Another thing that arises from poorly treating or poorly managing hypertension, or even ignoring it totally. There are several other things that can worsen the situation for you, including stroke. Yes, I said it's stroke. You can suffer from stroke. You can also suffer kidney failures. or rather kidney failure. You can suffer retinopathy. It is an eye problem. You can also suffer dementia, loss of memory. There are so many things that can arise from not properly managing hypertension, or not even knowing you are hypertensive, and death is one of them. Unfortunately, death is one of them. Hence the name silent killer. So please look into your health today, guys. I hope I passed a very good knowledge to you guys that you people would understand. Please, I would appreciate any question. I'm going to be talking on, I don't know if I want to be talking on the food you should eat, and I don't know, but I hope you make your research, talk to your doctor, have a doctor. It is important. Okay, thank you for listening to me, guys, and I hope you learned something from me, and ask your questions.